Good afternoon, everybody. We will take just a few minutes here while everybody comes in from out of the waiting room because it usually takes just a little bit for everyone to filter over. Thank you so much for joining us today for the third in our four-part series on frontline staff education. Today, we are talking about becoming a high reliability organization and what that means and what your role is in a high reliability organization and how you can achieve that in your hospital and help make that happen. All of these webinars are made available through our Medicare Beneficiary Quality Improvement Program, or the FLEX program. This is a grant-funded quality improvement program that comes down through the Federal Office of Rural Health. They basically provide grant funding to our state Office of Rural Health, and Texas Hospital Association and the Texas A&M Rural and Community Health Institute both partner with State Office of Rural Health to provide pieces of this, which our portion is a quality improvement, technical assistance, and education for all of our critical access hospitals across the state. We are very happy to have 91 critical access hospitals, which is certainly more than any other state. And so we are very happy to help support all of you in terms of education or anything that we can do to help improve the quality of care for patients across Texas. These webinars are approved for one continuing education credit for nurses per webinar. What we will do is at the completion of this series, which will be next week's webinar, we will send out an email with the information on the CNE portal. Basically, it will include all of the login information that you need. You'll log in there, you will complete the evaluation, and then you will get your CNE certificate at the end. You'll be able to select the webinars that you participate in. It's just on the honor system. So whichever ones you were able to watch live, then you just click on those and you'll get a CNE per webinar. So a total of 4 CNEs could be obtained. If you are not nursing, you will be able to get a certificate that says that you attended the webinar. Now, if you are watching in a group, because we have this a lot in which one person will register and have the login, but everybody can sit around in the conference room and watch the webinar together. If you have not actually registered individually, we encourage you to do that because when we send out the evaluation, when I send out the portal instructions, if I don't have your email address, then you're not going to get that information and you will rely on one of your colleagues to make sure that you do. And then the portal will only stay open for 30 days at the completion of this series. So you're kind of on a limited time there to go in and do the evaluation. So if you have not registered individually and you're watching with others in a shared space, please make sure that you do go in and register for the webinars so you'll get the email with the CNE information. Just a few learning objectives for today. We are going to be talking about high reliability and what that is, what it looks like. We're going to be identifying ways that frontline staff exhibit high reliability and how you can assess for system issues that increase the risk. We'll also talk about some human factors and culture of safety, because those two things definitely play a part in a journey towards a high reliability organization. So why high reliability? If you may not be familiar with that term, but if you are, why do you think that we would want to achieve an environment where we function at a high reliability in a healthcare organization? You can, I mean, if you have something to drop in the chat, you can go ahead and do that if you're familiar with that term. If not, that's okay too, because we're gonna define it and we're gonna talk about why it's important. Carmen, raise your hand, but if you can pop it in the chat box, that would be good. Builds trust, absolutely. Builds trust from the front line all the way to your leadership, but also leadership has trust in the staff that they have. So to understand why we need high reliability, we have to look at patient safety in general. And last week we talked about quality improvement, and we talked about the cost of things that occur inside a healthcare organization, like hospital-associated infections and falls with injury, and the cost that those in part onto a hospital. But medical errors are considered the third leading cause of death in the United States. And there are a couple of different studies out there that might give you just slightly different information, but basically 1 in 4 to 6 patients inside hospitals within the United States are harmed while being in the hospital. And that's a significant number. I look at our department at Texas Hospital Association, and there are 4 of us within our department. So that means at least one of us would be impacted by a harm event if we were all hospitalized. And so we certainly can do better. There are studies that suggest out there that as many as 50 to 60% of our medical errors are actually preventable. So imagine how many harms we could eliminate if we simply enhanced our awareness of safety concerns and did something to mitigate those. Misdiagnosis and medication errors are the leading cause of error. And healthcare organizations and professionals, we certainly have a duty and a responsibility to our patients and those in our community to not only provide safe care, but it needs to be reliable and it needs to be patient-centered, which goes back to the very first webinar where we talked about patient-centered care. So think about this, and this one is one that you really kind of have to grasp. We have research out there that shows humans make 35,000 decisions every day. And at first, when you hear that number, you think, wow, that's a lot. How is that even possible through the course of a day? But stop and think how your decision making starts from the time you wake up in the morning. You might decide which coffee you're going to have for the day. If you're like me and you have a Keurig and I've got several different options next to it, I've got to make a decision as to which coffee to have during the day. You'll make a decision as to what you want for breakfast, what shirt you're going to put on, how you're going to fix your hair. And you have any number of decisions that you make beginning from the time you wake up to the time you go to bed. With that, we experience 3 to 6 errors every hour in normal conditions. And so those can be little things. How many of you have left the house? You get in your car and you take off driving and you get 2 houses down and go, oh, wait, I forgot my phone, or I forgot my debit card. And you have to turn around and go back. Little things like that that are one little change in your process can cause you to forget something, omit something that you need to worry about. We experience 11 to 15 errors per hour when we're in stressful or emergent conditions or those that are unusual. So now, not only are we already at this normal conditions of 3 to 6 errors per hour, consider what that's like when you get at work and you have multiple patients that are really complicated, might require a high level of care and things like that that you have to remember. So you pile all that stress on, then it makes us more prone for error. Add to that, we get tired. Maybe we have lack of sleep for some reason. We're just not on the top of our game. We have outside factors that influence. And so we definitely can increase our risk of error when all of those things pile on. Now, high reliability. What exactly is high reliability? When you have high reliability in an organization, you operate, these organizations typically have very complex systems. They're very high risk environments, but a high reliability organization is consistently functioning with safe and effective outcomes. So some examples, the first one listed there, aviation. You might not be aware, but a lot of things that we do in healthcare in terms of our quality improvement processes and strategies, customer service, a lot of things have been influenced by other industries, aviation being one of them at the top. So they're also one of those very high reliable organizations. Nuclear power and of course, healthcare. One of the key features is that we work to minimize errors despite being in those high risk situations. So the whole goal is focused on safety and being able to identify and stop an error before it actually occurs or reaches the patient. So the Joint Commission Center for Transforming Healthcare states that high reliability means that consistent excellence in quality and safety across all the services, and not just short term, that consistency is maintained over a long period of time. So being a high reliability organization isn't something to where you achieve this high rate of good outcomes for 1 month, 2 months, or maybe 6 months. It is something that you sustain long term and you continue to work on every day. There are 5 core principles to high reliability organizations, and we'll talk about each one of them individually. But the first is a preoccupation with failure. This is being very focused on everything that could go wrong. A reluctance to simplify, and this is talking about some of our processes and procedures. The sensitivity to operations, a commitment to resilience, and a deference to expertise. So we'll talk about each one of those individually and see how they play a part in making your organization function at a high reliability status. First of all, preoccupation with failure. Again, this is being focused on safety. It's like you're just hyper vigilant about all of the things that could potentially go wrong. How many of you get an order or something, a task that you have to complete, and you sit there and you think about what the outcome is going to be when you complete that task? So maybe it is giving pain medication. Ideally, we have a new patient, we want to give pain medication. We would like to see the positive outcome that the patient has less pain. But if you're preoccupied with failure, then you're going to be thinking about every possible thing that could go wrong in that medication administration. So going down the pathway of, what if I get the wrong patient? What if the patient's allergic to this medication? What if that's not documented? So you're literally thinking about all the possible errors that can occur so that you can be hyper vigilant and make sure that those don't happen. You encourage reporting of near misses and errors. I've talked about that and mentioned that multiple times because ideally we want to report things before they actually make it to the patient, which is what a near miss opportunity is. That's where something almost happens, an error almost occurs. But if we don't know that there's a potential issue, we're not aware that there's something to be fixed. And you also view those small problems, that's your warning sign. That's kind of like the flashing light telling you, the yellow lights telling you caution, there's something up ahead. So those early small problems, if we can mitigate those and identify them, then we prevent getting to the catastrophic outcomes where you have a significant patient harm event or patient death. Reluctance to simplify. We avoid oversimplifying explanation for problems. So sometimes it isn't so simple. Some oversimplification might be just taking something, maybe you have a problem that occurs, and you chalk it up to say, well, that just happened one time. I don't think that'll ever happen again. And so you just make a very simple explanation for it and walk away. We certainly don't want to oversimplify anything, because if it continues and it keeps happening, then it could become worse and worse with each episode until you do have something really bad happen. You dig deeper to look for those root causes to things. And this goes back to a root cause analysis. If you've heard that term, that's where we do a really deep dive into an incident and we pick it apart at every level so that we can see exactly what happened, where the weaknesses lie, and what we can improve upon, and using multiple perspectives to problem solve. This goes back to the discussion last week about bringing everybody to the table to talk about things, not just nursing. Even if it is a nursing issue, you want to make sure that you have everyone else represented at the table as well, because I may go to change one of my processes and not realize how it's impacting someone else. So that's where you bring everybody to take a look with a fresh set of eyes. And sometimes those looking from the outside in will have a different perspective, and that will shed light on an even better solution. Sensitivity to operations. This is where we maintain an awareness of our frontline conditions. And this is why you play such an incredible role in not only just the general provision of patient care, but in our quality improvement processes and how we achieve success in those. We have to always be aware of what's going on in the front line, how it works, the issues that might be there, how it can be modified, and how it can be improved. Our leaders and staff should be able to communicate openly. And it is, I understand, can be very frustrating if you do not have those good open lines of communication to where you identify something that you feel could potentially be an issue. You try to take that forward and you're kind of met with some resistance or barriers there. So when we have sensitive operations, we don't have those barriers. There's open communication and you can freely bring forward any kind of issues or ideas that you have. And you have real-time monitoring of your systems. We always strive to do quality improvement, and that can only be done with concurrent and real-time data. You cannot sit there and look at data from 8 months ago and say, oh, we identified an issue here, now we need to fix it. Might not be your issue anymore, but then it could be something completely different. It could have morphed into a much bigger problem. So we always have to monitor things real time, concurrently as things are happening so that we can stay on top of everything that we do. Commitment to resilience. This is the ability to respond to unexpected events. One of the things that we have to do as healthcare providers across any discipline that we have is be able to adapt and overcome, because sometimes things are going to happen. They'll happen very quickly and very unexpectedly. And we have to be able to think on the fly and critically think and figure out how we can not only overcome that, but prevent it from happening again in the future. And we learn from our past mistakes. You always hear the definition of insanity as doing the same thing over and over again and expecting a different result. If we make a mistake, we have to do something about that and correct our course of action and make sure that we're not doing the same thing over and over again, because all it's going to do is lead to more mistakes. So we have to learn from those things. And we have to have a continuous improvement mindset. And with that, it's continuous learning. Healthcare changes daily. And so we always have to be in the mindset that we have something else to learn. I personally have always said that the day I feel like I know absolutely everything there is to know about nursing and healthcare, that's the day that I become a risk to not only myself, but to the patients, and I need to find something else to do. So we have to always be humble and understand that we have more to learn, and we always have ways to improve and be better. Deference to expertise. This is where decision making is done by those with the most knowledge, not necessarily by those that are in authority. Meaning, those at the front line should have a say in decision making processes. When you need to modify things, you need to do things better or different, rather than have someone from the top simply say, you're going to do this, and this is how you're going to do it. Because it's those with the expertise and the knowledge in that actual role that are going to be able to understand whether that would even work in the first place, or whether you're going to expend a lot of time and energy on something that you already know isn't going to work. It encourages speaking up regardless of rank. This is where anybody at any level of the organization feels empowered and has the ability to, number one, bring forth any type of concern without fear of any type of retaliation or anything else, but also ideas for improvement. Because again, some of the best ideas come from those who are actually in that role doing that work, and not necessarily from us who aren't. And it promotes that interdisciplinary collaboration. Last week, I talked about quality improvement is a team activity. It takes all of us to provide good quality care and to improve upon our systems and what we do. So we all have to be able to come to the table and work together and understand the different job roles, the different job functions, and how they all work together to achieve the same thing. Now, characteristics, just a few quick examples, characteristics of a highly reliable organization. With that preoccupation with failure, we have a lot of standardization of processes. And the more you standardize something and eliminate every little possible variance, the higher quality process it is. So, for instance, think about something as simple as starting an IV on a patient. And I'll use a lot of nursing examples simply because they're pretty easy to draw from. Um, every nurse has a different way to start an IV. I mean, it's all basically the same, but it's a little bit different. I might gather my supplies a little bit differently than my colleague Nina may. I may have a different process in order of which I do things once I get to the bedside as she does. In the end, we can both successfully start an IV and do what we need to do for the patient, but our process might be a little bit different. There might be things within my process or her process, those little variances that we can get rid of, and that will decrease the risk that either one of us could potentially make an error. So that's why we have good standardization that we need everybody to follow. Checklists, I know these can be cumbersome. And a lot of times when we're presented with one more checklist, we all sit there and think, another checklist. This is just going to take up extra time. But checklists actually help us make sure we're not missing something. We get in a hurry. We have circumstances with patient care. Some may be a lot sicker than others. And sometimes you can get into an emergent situation where you need to do things very quickly. And those checklists, while they may be cumbersome, they actually help us keep from leaving things off, make sure that we do all of the steps we're supposed to do. And again, going back to that reporting of those near miss opportunities, you hear that. I know you're probably tired of hearing that, but that's how important that is, that we know that those things happen. Under reluctance to simplify, we're looking at those human factors and system engineering, and I'll talk about those two things a little bit here in just a second. But those two things play a huge part in our potential for error and risk of having things happen. Sensitivity to operations, again, reporting those errors and near misses, but also having a fair and just culture in which we're not so focused on the punitive nature of mistakes when they happen, but being able to identify that it isn't necessarily that someone was negligent intentionally or did something to make a mistake, but that there's a system or something in place that kind of predispose that. Deference to expertise, going back to that team culture where everybody can work together, and the flexibility to understand how everybody's roles can impact, or how your role can impact someone else. And understanding that sometimes we have to have a little bit of flexibility when working across disciplines so that we make sure we're all able to function as effective as we can. And commitment to resilience, that willingness to learn and grow and continually striving for improvement. Because no matter where we are in the course of our career or as an organization, there is always opportunity for improvement. Now, culture of safety and human factors with system engineering. You cannot make it to high reliability if you're not looking at all three of these things, because they all play a part in achieving that high reliability for your organization. So we'll briefly touch on each one of these. First of all, looking at culture of safety. This is something that we have to achieve, and this is across the board with all departments on how we do this. And exactly what is that? Well, basically, this is when you have a safety culture across the organization where you have shared perceptions, beliefs, and values, and everything that create this commitment to safety and an effort to minimize harm. Again, going back to where safety is at the forefront of everything that you do, and you're constantly evaluating everything that you do, looking for the things that can potentially go wrong. And that way you can mitigate them before they ever happen, before something reaches the patient, and you're constantly working on that process improvement to eliminate the risk of harm in everything that happens within your organization. So when you build a culture of safety, first of all, we have to acknowledge that healthcare is high risk by nature. Everything that we do, it's just the whole provision of care from registering patients and triaging them appropriately, getting them the care that they need, medications, lab tests that we do, radiology tests that we do and reread, like everything can be high risk to those patients. It's building a blame-free environment, and that's the just culture. Historically, we talk about how in healthcare, way back in the day, when mistakes are made, someone always gets in trouble for them. And as we've evolved in healthcare, we recognize that it is not necessarily one person who created an error or acted negligently. It's that system. Sometimes our own processes and procedures set the stage for an error to occur. And so we are now evolving to where we're more of a blame-free environment. That's not to say that if someone is absolutely negligent, that they should not suffer some sort of punitive reaction as a result of that. But for the most part, that's just not the case. And that brings us to just culture. Again, that collaboration across the ranks and disciplines. So this goes from the board level down to the front line, where everybody can collaborate. Everybody has the same goal in mind. Everybody is striving to achieve the same thing. And everybody absolutely works together. And the organization has to have a commitment of resources. And that simply means that if you need education, you get education on something if there's an issue. If you have bad equipment, you're going to get your equipment updated or replaced. Like you have a commitment to resources to take care of the needs in your organization to make sure that it is a safe culture. Now, human factors. This is going back to the things just inherently as humans, how we interact with our environment and everything around us, and what that does, because sometimes we have the best processes laid out, and you may have a complete procedure laid out on paper, but once you put the human component to it and the humans start actually carrying out that process, then you might have to take a step back and reevaluate it, because how does it actually interact and how do people actually carry out that and do those things? That's what the human factor is. Where the errors occur and when they occur, they're just less likely to lead to patient harm when you can sit there and evaluate that. So how do we interact with our work environment? You have a lot of equipment. Think about not only in a nursing environment, but think about the laboratory. How much equipment do you have in a laboratory? It's almost all equipment. What about in radiology? How about in housekeeping? You still have some equipment that you have to operate to do your job. So how do we take that and how do we interact with our environment around us? So oftentimes all of these things are not accounted for in terms of interaction with the actual people that have to carry out the functions. And so this can lead to unintended errors or medical mistakes and things like that. System engineering, that brings us to the system engineering part. This is a set of components that interact together to accomplish a common goal. So it might be the design of the overall system when you talk of engineering, effectively designing that and integrating all of those components, ideally is what makes it possible for you to do your job and do it well. But is it always engineered the best way possible? Think about building a brand new hospital and you have an architect designing a building, but if they're not consulting the people who are actually working inside the building and performing the duties of patient care, maybe they do things in a way that makes it more difficult and sets you up for mistakes. For example, what if the supply closet is as far away from the patient care area as possible for aesthetics. But yet, what does that do to the ability of those who have to get things from there to provide bedside care? It takes longer. It's not as efficient. And then what happens? You have people start putting supplies elsewhere where maybe they don't belong and things get missed. So you have to think about how the system's engineered and how that plays a part in what you do on a daily basis. A good way to think about how we can set ourselves up for error is thinking about every step in the process as a piece of cheese. And so when you line up all of these pieces of cheese, ideally, if it's like Swiss cheese, the holes are not necessarily going to line up together. So you may have one piece of cheese, which is your nursing process, and you have another piece of cheese, which is your laboratory. Well, since those holes in the cheese do not necessarily line up, that makes it harder for mistakes to make it all the way through the layers, because there might be a stopgap there because the solid part of the cheese for the laboratory covers up the hole where the mistake can be made for the nursing, if that makes sense. So ideally, you've got some stopgaps along the way. We don't want all the holes in the cheese to match up. We want there to be some kind of stopgaps, but we have to consider every single layer of what we do. There's things in that layer that can predispose either that layer or the next layer to some type of a mistake. And so we have to consider all of those things as we go through the process. When you look at this picture, you may not have ICU capabilities inside your organization, but if you look at this picture right here and you have one person who's in charge of all of these things, all of those IV drips and pumps and everything else, what could possibly go wrong here? It's complicated. This is just a great example of the complexity of everything that we do and why it's important for us to pay very close attention and be very mindful of every potential thing that could go wrong and plan ahead for those things. Now, moving to high reliability, you have to take some steps to get there. And certainly from the frontline perspective, you play a huge role in moving to high reliability, and you can actually drive your organization in that direction versus sitting back and waiting for it to come from the top down. First of all, you do have to have leadership commitment, and they have to be on board with that. And so sometimes it takes a little bit of nudging. And if you look down, the last thing on there is empowering your frontline staff, but you can be empowered and take the lead from the beginning. Open those conversations with your leadership, whether it is your department leader or whether it's leadership in your organization. If you see things, if you have ideas on how things can be safer, can be done more efficiently, bring those ideas forward. You hear the squeakiest wheel gets the oil. If you start talking and you're not getting some traction, just keep talking, and eventually it will catch on. You have to have that safety culture development. And Linda, I saw that you raised your hand, but you can put something into the chat box. I am not sure how to take the hand raise off from this screen. Oh, mistake. No worries. It happens. You have to have robust process improvement. And talking last week about quality improvement and the role that everyone plays, it's everybody's job. And so quality improvement is something that should go across departments. You should always striving for improvement or looking for opportunities to do things better. Learning systems, going back to that continual education, and always be moving forward and never be stagnant to where you're kind of just sticking with the status quo and staying in one location. How many times have you heard when you brought something up and you hear, that's how it's always been done? If somebody tells you that's just how we've always done it, that's a good indication that that might be a process to take a look at and see how you can do it better, because you should have no processes in which you cannot give a good explanation as to why you do it the way that you do. Um, Challenges in becoming a high reliability organization. First of all, resistance to change. Change is really hard. And sometimes it can be really uncomfortable. But change is necessary to keep moving forward. It goes back to that's how we've always done it. Attitude and mentality. And sometimes it's really difficult to get traction, but that's why we need everybody to play a part. Limited resources. Our small hospitals do so much more with less than any other hospital out there or organization. And so the resources can be very limited. And so that's definitely a challenge. Communication barriers, I think, are always our biggest struggle. Sometimes one person may have a fantastic idea, but they have difficulty articulating it. And so when they try to bring that idea forward, maybe it doesn't come across quite the right way. Or maybe if it is, for instance, your laboratory is trying to talk to the nursing and say, hey, you really should do something a little, if you modified this process, if you did this differently, it would make things easier for us. And sometimes it's just how it comes across to another discipline that it might break down the communication channels there. And so communication is really, really a difficult one. And that can be a challenge to any type of improvement that we do. And maintaining momentum. You might start out thinking that you have a fantastic idea and you put it into place and it's not successful. So you come back to the drawing board and you come up with something else. And then you put that into place and that's not successful. And you just feel like you keep running up against all of these roadblocks. And it's really hard to maintain momentum and a positive outlook on things and that drive to move forward when you're met with resistance along the way. So that certainly can be a big challenge as you go forward. To overcome these challenges, clearly we have to foster open communication. And that's from the frontline staff all the way up to your highest leadership positions, making sure that everybody feels comfortable and safe coming forward with issues that they identify, potential problems, or possible solutions. Getting adequate training is difficult. Sometimes it's hard to access and sometimes it can be very costly. If you're met with resistance in terms of getting training that you feel is really important for you and the rest of your colleagues to do your job well, then take the time to research and maybe look up the training opportunities, how much it costs, write out the benefits, but also write out the negative consequences of not getting the training that you need. And so sometimes being very well prepared like that increases your likelihood of getting what you're looking for. Celebrating those small wins, and that this does not have to come from your leadership. As colleagues, we should be supporting each other. We should also be recognizing each other for things that we do that are fantastic ideas or for avoiding those mistakes or catching something before it happens. And think about how you would feel if your colleague, for instance, maybe you identified a safety issue and you were able to report it and get something done before it became a big deal. How would you feel if your colleague, not your department director, or not your hospital leadership? It's great when they recognize you, but what about if you're just straight level colleagues came up to you and said, hey, that was a really good catch. I had never seen that. And I'm glad you were able to catch it because now I'm not going to make that mistake either. Those are big things, and we should celebrate all of those small wins, no matter what they are. We should be recognizing each other. We should be supporting each other, and that just improves morale in general and helps us keep moving forward and elevate our patient safety game. And ensuring leadership visibility, and this is two things. Number one, leadership needs to be visible to all of the staff in terms of helping to lead the charge and support a culture of safety and moving to a high reliability organization. But you also need to be visible to leadership in terms of what you're doing to actively work towards building a culture of safety and improving the quality of care and things that go on inside your organization. You measure progress. These are those quality metrics that we collect, all of this data that we collect. We have all of our patient safety metrics. You have staff engagement scores when you do that annual staff survey, looking for employee engagement, how you feel about your environment. Are you getting everything you need to do your job well? That type of thing. Our incident reporting trends and all of our process improvement outcomes. You should absolutely see how well you're doing. You should know where you're at in terms of your department for your quality improvement metrics, where you are successful, where you still have opportunities for improvement. And if you're not seeing this information and having that relayed back to you, ask. Ask your department director where you're at with quality measures and how you're doing as a department. Ask your quality leader. Get to know them and understand what they do and why they do it. But get to know the data, and that way you can stay more informed yourself and know what you can improve upon and where you're doing very well. That helps you celebrate those successes, but then also keep in the back of your mind the areas where you can continue to improve. So what does it look like for frontline staff to show high reliability? First of all, that vigilance and being the early detection system. You are the ones who help identify and report any of those potential unsafe conditions, those small process failures that occur. You're the ones who know about it first. So you're the ones who can bring it to our attention to let us know that there is a potential problem and something that needs to be addressed. Um, it means that you speak up and you have that deference to expertise. So you can raise your concerns regardless of whatever the hierarchy is when the safety is at risk. But you also listen to those who have relevant knowledge and you accept their perspective and their input, and you take all of that into consideration. It goes back to that teamwork where everybody has to work together. And adapting quickly to the unexpected. That means we always have a little bit of flexibility. We try to be resourceful during those unplanned events, but we also make sure that we strive to maintain patient safety when doing so. So how do you make it happen that your organization can move into high reliability? First of all, actively engage in safety practices. How many times do you know that you're about to have a fire drill or something like that? And you just happen to make sure that that's going to be the day you need to take off because you have something to go do. Um, don't avoid those things. That's how we prepare for things that can happen in our organization. Be involved in those safety practices. It might be helping to come up with a scenario that you're going to have for that day. Because you never know. One of our hospitals experienced an internal disaster, and in reaching out to them and talking about the event after the fact, one of the comments that struck me that I think everybody should consider was, as much as they had prepared for and drilled for an evacuation, none of that was enough for when it actually happened. So don't avoid these safety practices or drills or anything like that. Be engaged in it and actually participate in it. By all means, report any hazards that you find in the environment and any of those near misses that occur. Participate improvement initiatives. It goes back to being involved in a quality improvement team that is put together to meet a certain challenge that your organization has. Get involved in that process and understand how those improvement initiatives work and actually help facilitate change. And support your colleagues in high stress situations. You never know what someone is going through outside of the organization. Sometimes you will because you're a smaller staff, and so you tend to be very close knit, especially in our smaller communities. But when we have incidents that go on inside the hospital that are very, very stressful, make sure that you can offer them support. Doesn't mean you have to go sit there and do all of their work for them, but certainly be there to encourage, offer a hand if you have the ability to do so, but to be able to help them with some of the stuff that they have to do. Again, cannot stress it enough. Report those near misses, document and share those wherever something almost occurs, because this is how we can take a look at the workflow. This is how we can look at what the lines of communication were, and we can identify the weak links in the process and figure out how we can fix those. Participate in safety huddles and debriefings. Anytime that you have some type of an incident where you do have an error that occurs, it is always a good idea for everybody to come sit down at the table who may have been involved in that and talk through the process and look at what happened, where did things possibly go wrong, and how could that have been prevented. Input into the root cause analysis. If you've never thought about one, a lot of people look at root cause analysis and they're very defensive about that process, because somebody's going to come to you and ask you a whole lot of questions about what happened. This isn't like an investigation because we're trying to prove that you did something wrong or try to get you in trouble. We're trying to figure out exactly what happened and what in the system could have potentially caused an error to occur. What was that underlying factor? So be involved in that process and don't look at it as a negative or something punitive. We're just looking for the details and the information so that we can make sure it doesn't happen again. Use those checklists and audit to help spot those gaps. If you're asked to help audit charts or to look for things, don't just take that lightly and glance over it and to be done. Really take a look at it and see if you can spot little things in the process that could facilitate an error or something like that. And escalate those recurring issues through your established channels. Again, going back to the squeakiest wheel gets the oil. If you've brought forward something that you think is a concern and you're not getting any traction, elevate that. Keep going back. Don't stop just because you reported it and you think, well, I reported it, now I'm not going to worry about it. Because if it continues at some point in time, there's going to be a patient harm. And you don't want to sit back and think, I should have kept telling them about it. I should have elevated that to the next level and I didn't. And now somebody was seriously injured, or potentially worse, someone loses their life along the way. Share feedback during policy or workflow changes. This is where we're trying to implement change. If it's not working and you've got a possible solution, share that feedback, collaborate. Process mapping, this is where you sit there and you bring everybody to the table and you literally write down every single step in the process across all departments to look for the potential weaknesses in there, and things that you can modify or ways that you can do things differently to make it more efficient, eliminate variation, and streamline everything to reduce the risk of error. Your role in patient safety culture, educating yourself to understand quality and safety and how to collaborate and implement changes. We have to take some of that on ourselves and be responsible for our own education and understanding. We cannot sit back and wait for someone else to do it for us. It's really important that we take charge of some of that and take ownership of it. You have a role to support your leadership with that data collection, and help with all of that strategic planning and implementing change, and looking at that systemic change and working through those root cause analysis and helping those processes. So again, how your organization can achieve high reliability, a leadership commitment to zero harm. I know that seems, you might sit there and think, well, that's not going to happen. That's unattainable, zero preventable harm. But that really should be our expectation, not just a target goal. That should be what we expect to see. Because when you think on those terms and you're really safety focused, you're going to achieve high reliability and you're going to reduce patient harms along the way because you're really looking out for the things that can occur. Consistently model safety behaviors, and this should be from all levels of the organization. You should model the behavior that you want to see in someone else, in your colleagues, in your leadership. Everybody should be modeling that. And then build and sustain that strong safety culture where everybody feels safe speaking up about any potential hazards or mistakes that are found without fear of any type of retaliation or negative feedback. And certainly recognize and reward those that do bring those things up and bring them forward. Apply those, going back to those 5 principles, apply those 5 principles into the workplace at your organization, and implement them, and then hold everybody accountable to them. And have a very robust process improvement, quality and process improvement. Again, going back to quality is everybody's job, from the front line, every single department, all the way up to the highest level, which would be your board at your organization. It's everyone's role and responsibility. Strengthen your learning systems. Make sure that we collect and analyze that data and provide that data to staff. And again, if you're not getting that data, if you don't know what's being collected in your department, ask so you can see it and know where you're at. Engaging and empowering frontline staff, because you are absolutely the starting point and you are absolutely important. We cannot achieve success without you, and we also cannot identify a lot of our system issues without you. So putting it all together, what everything looks like, the takeaways. High reliability organizational principles can absolutely improve safety and the quality of care that we deliver to everyone. You are a critical role in everything that we do, not just the delivery of care to the patients, but how we make it better, how we sustain that improvement, and how we achieve a high rate of success to the patients that we serve. And we have to have that commitment to quality. We have to build that culture of safety, and we have to practice continuous learning. All of those are key features and absolutely essential as we go forward. You are the biggest piece of this puzzle, and we want to make sure that you know that. We know how important you are, and hope that you know that, and hope that you feel that in your organization. But you have the power to impact everything that happens, and so we hope that you have a voice. If you don't feel like you have a voice, we hope you find it, and put it to use going forward. And with that, I'll stop for a few minutes and see if there are any questions. Carrie asked about an RCA, a form for documenting RCA, and it looks like.
Yeah, I dropped in a document that we use here, and it looks like someone else also shared what they use. So a couple of different options there for RCA.
And I like what Gideon said about frontline staff stopping and evaluate situations. I think a lot of times we get in a hurry, and we're not critically thinking. I feel like in many circumstances that's lacking a little bit. I know my son just graduated from nursing school, and it was interesting because he even commented to me the other day. He said sometimes it's really easy to almost lose that, where you just start feeling like you're falling into a routine of doing things rather than sitting back and really critically thinking about what you're doing, why you're doing it, what the outcome is or could be. But definitely stopping and evaluating situations, and especially after event, to learn what went well, what didn't, and how you can improve. And definitely don't assume that leadership is just going to make decisions for you. Absolutely. Absolutely. We all have to be a part of that decision-making process. I think that when you have staff that are empowered and feel like they can make decisions, and they're free to have input, you have such a high level of employee satisfaction because you feel valued. You feel like you're important to the organization and not like you're just a warm body filling a staff position. And so that builds staff retention, staff loyalty, and you're going to see the quality of patient care go up by those things alone. And so I think that's really important to give your staff that feeling in their environment. We have one more webinar next week. We're going to be talking about AI in healthcare. There's so much going on with AI right now. It's absolutely crazy the things that people can do with AI, and what they're doing, and some, not all for good purposes. So we've got to talk about AI in healthcare and what that looks like, but how things are changing and what we need to be ready for, but also how we can mitigate potential issues with AI in healthcare, because undoubtedly at some point in time, we're going to come up against some. So join us next week, same time, same place, Tuesday at noon, and that will be the last in our 4-part series. My contact information, I'm always happy to answer questions if you have them. So please feel free to reach out to me if it's something and I do not know the direct answer. If I can't find it, I'm certainly going to get with my colleagues until one of us does, and we'll get back with you. But please feel free to reach out to me at any time with any questions or anything like that. Even if it's just to say, hey, this education was great, but can you do something on this topic? Because this is something we've all been talking about or thinking about. We love to have your ideas. I want to know what all of you need education in, or what you would benefit from. So please feel free to reach out to me with those ideas as well. Thank you for joining us. I'll give it just a brief second here in case anybody has any last minute questions. Otherwise, we absolutely appreciate you joining us. And we look forward to seeing everybody next week as we wrap up the series. So I hope you have a great rest of your day, and let us know if there's anything that we can do. Bye, y'all.